Hey there, mom. Hey there, dad. It is important that you know when your baby is constipated or it's just normal pooping pattern for him or her. Is your baby straining really hard? Or has it gone 3 days without your baby pooping? How can you tell if your baby is constipated or not? Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to empower you moms and dads so you can raise happy and healthy kids. In this video, we will talk about the normal pooping pattern for breastfed babies, formula-fed babies, what are the signs of constipation, and what can you do about it at home? Constipation in babies. Most parents worry, especially new parents, worry that baby is not pooping enough. So, what is a normal pooping pattern? For a formula-fed baby, they normally have a bowel movement at least once on most days. It is usually 1 to 2 days between bowel movements is still normal for formula-fed babies. How about breastfed babies then? Well, it depends on their age. And if baby is in his first month or less, they usually poop several times a day. If your baby is less than a month old and is pooping less than once a day, then it might mean that your baby is not taking enough milk. Now, for breastfed babies who are 2 months or older, it is normal to go several days without a bowel movement. Even a week without a bowel movement is okay for them. Then how about straining? If your baby is straining, does it mean he or she is constipated? Well, infants work really hard to have a bowel movement. So straining at pooping is not necessarily worrisome for your baby, even if your baby gets red in the face or is crying really hard. Infants require major effort to have a bowel movement. Just imagine lying on your back and trying to poop. Are you still worried that your baby might be constipated? Well, ask yourself the following questions. Is your baby fuzzier than usual? Are there more spit-ups than normal? Does your baby have more or fewer bowel movements than before? Is the baby straining really hard for more than 10 minutes without any success? And are the stools unusually hard, or they now contain blood related to the hard stool? These signs actually indicate that your baby might be constipated. Constipation in infants really is not that common, but these signs indicate that your infant may be constipated. If there are hard or pellet-like stool, if your baby appears to have a painful or difficult bowel movement causing him or her to arch the back, or crying really hard accompanied by hard and dry stool, and if your baby is pooping less frequent than his or her usual bowel movement. Hey there, are you expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you immediately feel confident about breastfeeding your baby. Or you understand your baby's sleep schedule so you can better take care of your baby and yourself. Or you know how to deal with a crying, fuzzy baby. How much better life can be when you have the training available at your own home. I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. After going through all the signs, you suspect that your baby might be constipated. It is best that you contact your pediatrician and ask for advice, keeping in mind though that the frequency of bowel movement depends on your baby's age and what your baby is eating. Remember, it is not unusual for exclusively breastfed babies not to go and have a bowel movement for several days. Infant constipation usually begins when baby is eating solid food. If your baby is constipated, try offering a small amount of water to his or her diet, or you can also offer juice, a daily serving of 100% apple, pear, or prune juice will be helpful. These juices contain sorbitol, which is a sweetener that acts as a laxative. What you can do is to offer 2 to 4 ounces of 100% juice per day to see how your baby reacts. Then how about baby food? Well, if your baby is eating solids, try pureed peas. These contain a lot more fiber than other fruits and vegetables. You can also offer whole wheat, barley, and multigrain cereals, which contain a lot more fiber than rice cereal. What if you already made changes in your baby's diet, but baby is still struggling and passing hard stool? Well, you can ask your doctor if a glycerin suppository may help. Remember though, glycerin suppository is only meant for occasional use. And do not use mineral oil, stimulant laxative, or enemas to treat infant constipation. Better ask your pediatrician about it. What if infant constipation still persists even if you made the changes in your baby's diet? And now you note signs and symptoms like vomiting or weakness? Then it is best that you let your pediatrician know about it. There might be an underlying disorder such as Hirschsprung disease, hypothyroidism, or cystic fibrosis. Hey, if you like this video, watch my next video where I teach you about other child health problems.